Well, we're going to be talking today about the effects of COVID-19 on psychotherapy and on relational therapy, and maybe more particularly. And this is also a kind of doubling up response to some of the things that therapists have been sending into us about their experience. And then we'll try to transcribe this and put it in the journal. So who wants to start?
Well, just to give a little bit more information about the three, about some of the prompts, we're asking, or we've been mulling over three big questions. One is, what are the positive and negative effects of therapists doing therapy online over an extended period of time? The second question is, how is therapy during the pandemic going to change therapy moving forward? And the third one is, how do we prepare clinicians as teachers, as supervisors, as colleagues about these changes? So over the next 20 minutes, the editorial team of the New England Journal for Relational and Systemic Practice will be talking about those three questions.
Well, I mean, the first issue is whether we even have the right to do that, given that we're sort of in the midst of it ourselves. We'll do the best we can in sort of giving some responses based on the responses of other therapists, but we're not necessarily the experts on any of this.
Right.
These are just some of the responses that we've been talking about for some months.
Yeah, and I think just to echo that, Stephen, I was recently preparing an agenda for a parent support group, and one of the topics that we were talking about was, how do you balance, parenting and working from home, and just this new method that we're engaging in together in terms of the stay-at-home order. And I found that myself and the co-lead, we were almost resistant to creating this this parent support group agenda, because we were finding the very things that we were coming up with, for this agenda, we were struggling with ourselves. How do you create a workspace that doesn't interfere with the boundary you've set between home and work life, right? And so, thinking about if you're doing therapy in your room consistently, how are you creating boundaries around that in your personal space? And so it's not affecting your own self-care and the way in which you are able to separate from the work, because now we're all engaged in it in one place and in one environment. So I just wanted to add that little piece that was coming up for me, that we're all struggling with this as we were trying to help parents and children and adolescents think about creating these boundaries in our home space. We're also having issues with this ourselves.
Go ahead.
I agree with that, Bev, because I think, and other people have said as well, is that they tend to be working more because that space is there. And it's not that they're going to their office and then there's a separation of home and office. And so they're spending much more time in their office and doing much more work than they ordinarily would have done before COVID.
I would certainly say these are some of the negative effects that we're seeing, that it's harder to have that separation now.
Working from home has its own challenges too. As a supervisor, I get to work with a team, and one of the themes that has come up more recently has been this feeling of disconnection. I think it has something to do with the time that we've been working from home. But there was something about being able to go to your teammate or your or the therapist next door or something, and talking out some questions that you might have about how to approach a service or a presentation. That was something that was really valuable for a lot of clinicians that were working and were working alongside other clinicians that were starting out. But now there's more of that reach out to the direct supervisors or like this managerial staff, and less of that sort of peer support. And that has been something that has been challenging for a lot of people. Or a lot of they don't want to create this dynamic where they're always asking questions towards their supervisor. And that's been something definitely that has been part of that conversation. I love these questions, but sometimes I feel some people might feel comfortable just going towards rather than using their peers towards the supervisor. I mean,
this kind of strikes me that the question, how do we prepare, clinicians going forward? It strikes me as a kind of a more kind of philosophical question. That the COVID and everything has kind of forced people to kind of speed up. But the question always is the same, is how am I thinking about this? And these conversations that we're having is exactly like what relational therapy is about, that the answer isn't in my head, the answer is between us. And so unless we are remembering that it seems like we're always trying to fix the problem, as opposed to, no, we're trying to speak, we're developing a way to talk about it that moves us forward. At least that's how I think, in a kind of a postmodern world that many of us kind of maybe inhabit, that the problem isn't inside the client, the problem is in the system. It's between us, how we talk about it, and then what comes next. So these seem like all really kind of such important and heady questions. But that's what I appreciate about the survey, is that we get a chance to talk about it and our community gets a chance to talk about it.
No, I was struck by one of the participants who said something I hadn't really thought about, and that his concern was that clients do not have the time to process before or after a session the way they would if they were driving to the session and driving home.
Right.
And it's something I really hadn't thought about, but really made so much sense.
So how so? That's just, I find that interesting. How does that make sense? Because they have the same amount of time they've always had.
Well, but they don't, because they say they're taking care of their kids, they run in to do a session, and they run out and they're back in the same environment. They don't have that space to, like, driving to the session and saying, this is what I want to talk about. They're helping their kids with their homework. I mean, actually being online teaching. So they don't have that space for themselves to, and I'm just wondering, for some people, I'm sure that's not true for everyone, what the impact that has on the work that we're doing.
I agree, Jackie.
And I think that there's an assumption that every client is a good candidate for teletherapy. Not every client is a good candidate for teletherapy. I have a couple that I'm working with that I'm in the process of having this conversation, that the process of teletherapy kind of shines a light on how disorganized their house and relationship is, and how they're just like really hanging on for dear life. And they need that separate space. Without that separate space, the camera itself is never settled. The point of impact is very seldom on the relationship. It's usually just on whoever's doing the speaking. And I think that one of the things that we're going to have to figure out, because teletherapy is not going away, one of the things that we're going to have to figure out is having conversations about when is it appropriate to do teletherapy, and also when is it not appropriate to do teletherapy? When is teletherapy not effective for folks? And do that not in a shaming way, but thinking about it more in terms of like the number of variables that are going on in a person's life.
I always think that you can check that out with the client as well in terms of the relationship, and like, is this working for you? Do you need a quiet space, and is this not a space that's working as well as being in the office?
Right.
Getting
Jackie,
back to
go ahead.
getting back to David's question about between us, I mean, one of the things that's between us is the computer. And this computer, we take it for granted that we can sort of all talk together. But there's this computer is between us and them.
Yeah.
And this is a problem for us, and it's a problem for the people that we work with. And the computer becomes problematic in thousands of different ways. One session goes really well. The next session, you have technical glitches. You have someone sort of walking around the room and you only see parts of them. A cat jumps up on the keyboard and you're gone for 5 minutes. There's all kinds of stuff that happens that prevents us from doing the work. And then that becomes the work in a way. Jeremiah was saying, maybe, we're gonna have to figure something else out or have a better connection the next time we talk, because we lost 20 minutes today because we couldn't connect at the beginning, we couldn't connect in the middle. It might be good if we kept the cat somewhere else, because, I know you love the cat, but when he jumps on the keyboard, we all go away. So the between us thing is the big deal. How do we do the between us thing?
Well, one of the things that I'm sort of reminded of, and as you say that, Stephen, is like the power of family systems was the observing team, at least in the beginning, having the watcher. And so we have the capacity with online, particularly with Zoom, to witness, for people to see themselves. So video recording, as we're doing here, that people have an opportunity to kind of see themselves, and do they show up in that encounter? What does that say about how they're seeing themselves? Are they embodying, are they being the way that they think they are? Is that consistent with their intention?
And also, go ahead, Frank.
I was gonna say, to your point as well, I feel like it sometimes amplifies what's being shared.
Yeah.
Because I've in my experience, some like youth and their caregivers, they might say something and sort of very quiet on the side, but you can't really be quiet in the same volume when you're through Zoom.
Right.
I've experienced where some statements are amplified, and I think it's more significant for when they're disclosed in therapy. Now that everybody's like having the headphones and being really attentive to what the other person is saying.
Well, and also thinking, David, about your question about the space between us, I'm also thinking about myself as a therapist, and how is the therapist that's on a computer screen, like looking into a computer screen, how is that person engaging in a different way than I would be if I was sitting with that couple in a room? For one thing, there's the way, for instance, that I've noticed that I engage with conflict a little bit differently when I'm able to like see it on a screen, that I can like remove myself from it in a bit of a different way, and actually like call myself a little bit quicker than I would be if I am able to engage with that same conflict like live as it's happening with me in the same space. I'm not saying that that's good or bad, just noticing that's different. That anytime we're engaging in some sort of like an avatar, some sort of a like technological representation of ourselves, that's going to have a different outcome than it would be if we're engaging with someone in a live space. And how does that impact the therapeutic process?
I agree with that on two fronts. So for me, it's a distraction because I'm seeing myself as well. And I think several people had mentioned that. But on the other hand, I'm looking at my own facial expression and then realizing, gee, I look too serious, or I think that there's another component to that, that there's that thinking. I think it's Holly Anderson or someone who talks about there are multiple things going on at once, both you and the clients are having your own thoughts. You're having this conversation together. And now I'm having two conversations, one about the client, but also about myself, and how I'm responding. Where in the therapy room, I can't see myself. And so, and I don't know if that's a good thing or a bad thing, but it's definitely a distraction and an added component to the therapy.
I would absolutely agree with that. And I'm thinking about too resistance and how resistance may show up right now over telehealth. And I think about how I might have managed that in the room, especially working with, adolescents or, treatment resistant clients that that need therapy, but might not necessarily want it. And now I'm thinking, rethinking what progress looks like in therapy. So if I can see, the top of your head, then I know you're still with me at least. And you haven't left the room, right? You haven't left the therapy room, and that's going to have to be enough, as opposed to, what I've engaged in the past at the beginning of teletherapy, like, can you put your mic down and you bring the camera so I could see your face? And that's essentially, the same if a teenager was on your couch and turned their back on you and said, I don't want to talk to you, right? So it's like, they've now flipped the camera to the ceiling, and that's their resistance, and that's going to have to be enough. So it's really thinking about how we manage that now, and how different that looks. And having to sit with that ourselves and tolerate that it's going to appear very differently over Zoom.
That also brings up the issue around body language. Someone else was talking about, you can't see what's going on, if the foot is going up and down, if the hands are twisting. So that it seems like there's less than information than you would get if you were in person.
Absolutely.
Along the same lines, I'm thinking a lot about your presence as a therapist in the virtual room, and how, especially with youth that or like clients that have experienced trauma, often you as a therapist are invited to sort of that state of alertness, and you in the room is very evident when you're there. But when you're in during these virtual times, it might be a little bit difficult to meet people where they're at if you can't see all of these signs that might come up while you're in the room.
And also, like, what's the experience of do they see the therapist kind of full screen? Is their voice too loud? That all of those cues that might sort of trigger that. That's interesting, Frank. Yeah.
Right, and you want to, and if they're inviting you to be there, are you meeting the needs of this sort of therapeutic relationship in the moment? I'm thinking a lot about that, and sort of if I am going there virtually, what's my ability to support this person during this session?
Yeah. And Frank, to add to that, what does it mean to virtually be a part of the system as opposed to being in real life part of the system? Some of you have talked about the different cues, the different signs that we miss. And I think it's much more than body language that we end up missing.
So it may go back to that question that you were posing earlier, which is not everybody is a candidate for online, that this online requires some kind of active an ability to participate given the medium.
Yeah.
So your screening, do you know what we're signing up for? That it requires you to be more active, to be more intentional, just like the therapist has to be more intentional.
Yeah, there's like I was thinking of Beverly's little family and the problem of teenagers and, putting their hood over their face and, moving like this so you can't see them, or moving right out of the screen. And the first time that happened, I was thinking about many years ago when younger people, teenagers, and younger children were coming in with their phones, and at first I was opposed to their looking at their phones. And then I realized that, when I asked them not to use their phones, I realized that I don't understand how they use their phones.
Mhm.
And so I started to allow, or their parents would say, I don't want you using your phone. And after a while I would say, no, it's perfectly fine that they can use their phone, as long as we all feel like we're listening to what's going on. Now of course, a 12-year-old boy or girl using their phone is a lot different than my conceptualization of what using a phone is like. I don't like to use my phone. So I prefer not to use the phone. I don't like phones, but this is not my experience. So we have to do another kind of translation now about a teenager in their room who moves the screen up. We just have to say, that's fine, you can do that, just as long as I know that you're still listening. And we have to sort of translate our visual experience in a room
Yeah.
to the media that we have available to us. So I'm going to have to, can you just somehow indicate to me that you're still listening? And you don't have to, I don't have to see you. And we have to keep doing these translations from what we used to know to what's actually happening now.
Yeah.
And that's difficult. And we don't have training for that.
Well, and I think it's especially difficult if you didn't grow up in the middle of the virtual technology revolution. Like I grew up more or less like instant message, those types of things. Like that was my adolescence, that was my early childhood. So like I figured out how to like engage and make sure that like my online presence is as close as possible to my real presence, even though there's like nuanced differences. And Frank and Bev, I'm curious about y'all's experience of this too. And I'm curious if younger therapists and therapists who didn't grow up, who didn't have their childhood and adolescence in the like technological evolutions of instant messaging and Facebook and all of that, if there's not a difference of experiences as therapists. So Frank, Bev, I'm curious kind of how the two of you are noticing the adjustments that you are making in being a virtual therapist, and how that might be different for Stephen, for you, David, and Jackie.
Well, I
It's
mean,
an
I know,
interesting question. Go
yeah, I
ahead.
mean, I'm thinking about my work with younger children because that is their entire world, right? And, as
Mhm.
young as 3, you have your own iPad and you know how to work it with the passcode. So I'm thinking about them and having to adjust and essentially, like, for example, engaging with a 5, 6-year-old on, Roblox, right? The app or online website where this virtual world where they play games. And I remember being like 4 or 5 weeks, that's what we did for therapy, right? We would meet in this virtual world, and my client, would show me this world that they're in, and having to say like, wow, talking to my supervisor, like, this is therapy. Like, I'm doing therapy. Is this okay that we are engaged in this app? And this is essentially how we communicate and engage with one another. And then having to, think about, like, as Stephen was saying, make the translation, like, what is this child really, doing in this app, right? What are the themes coming up? And essentially that would be equivalent to the child playing with my toys in the room. We're in another virtual world, just online.
Yeah.
And they're playing with me, but it feels different. It looks different. I can't, I'm observing it like an outsider behind the screen, but it's play. And so really re-envisioning like what it looks like for clients to engage on this online platform has been really interesting. And having to, I think, have validation, I think, from the treatment team, like, yes, you're engaging in these different treatment goals within this virtual world. And this is the option we have right now, and it's better than nothing. So this is how we're going to engage, because this is what they have. You can't go to their home. They can't come into your office. And so this is how you can play,
Mhm.
essentially online. So that's been really interesting for me.
We have
I
about
I
we have about 5 minutes left before we have to
okay.
stop. We blew right past the 20-minute mark. Um, but but um, but I didn't stop because we were talking. But we have about 5 more minutes and then we're done.
Okay.
Frank?
I was gonna say that I guess briefly that as a young therapist, I didn't have very much of a challenge getting used to like Zoom or Doxing Me or these and all these different ones that different sort of agencies use. Google Team, was it Microsoft Teams? That's been okay. The challenging part, I think, is in sort of the restrictions that come with doing services through telehealth. Especially, I like to introduce more expressive ways of or the interventions, I guess, in session. I think that it provides a little bit of energy to what families are working on. um, that though I can manage as a clinician, but I'm lacking that part of for the most part, not in every case, but I think that for sure has been something that I've had to, I guess, think creatively, which speaks to some of the things that Abeb was talking about. So not too many issues with technology.
I would say, I mean, yeah, I would say not too many issues, but even for me as like a younger clinician, I think when I think of technology, it's like it's part of my leisure world. Right? Prior to COVID, I went into social media for leisure and viewing that for leisure and all these other apps, and now it's feels like it's a vital part of the work. So I've had to just integrate. So that's been, I think, the biggest change, like integrating those two worlds. Like this is now part of my work, whereas before I'm really looking for that person to person, the relational piece that David was talking about. What's between us in the room, what's occurring in the room. And now it's, what's occurring in this virtual world that I can kind of pick apart in terms of how the client is presenting.
We haven't really talked either about the idea that there are physical changes in terms of presence. There's the problem that therapists are having with eye strain and visual migraines and things that we've never had to worry about before because we weren't looking at a screen for 8 hours a day. And these things need to be addressed, and other therapists have to realize that they're not alone when these things happen. When we get really exhausted at the end of the day because we're not getting a whole lot of feedback, sort of somatic feedback from the families that we're working with, that's a different kind of tired than we had before. When we were seeing people live. I don't think that the computer helps us to assess our own feelings between sessions. We move straight from one session to another without a whole lot of processing in between. When we're in our office, at least we get up and walk people out and we meet another person in the waiting room, or we travel to a person's house and we see them, and then we drive to another person's house and we get to process stuff. But we don't have that now. It's just that, and maybe grab a cup of coffee and then run back up to your screen, which is exactly what the participants that that we're working with are doing. They're not thinking about where their cat should go, or they're not thinking about we need a private space and I need like 10 minutes before and 10 minutes after so we can talk about what just happened. They're already thinking before the sessions even started about, well, this ends at 11:05. I have a meeting at my work.
It's sort of like it's a new era of social emotional learning for everybody.
Yeah, and we haven't really adjusted to the to some of these things. Yep, I mean, we're just doing them. We're not sort of adjusting or examining them or thinking about other ways of doing it, or rules or protocols. What are the rules? Should you have 2 sessions back to back? How many sessions should you have in a day? How much time off do we now need because we're doing all of this stuff? I mean, what should our caseloads be like? How much can we actually bear?
Or even policy. Should therapists be like piecework? That you have to see 80% of productivity or whatever it might be. It's almost like a pieceworker in a factory, kind of crank them out.
Yeah, and
I,
that's not going to work. No.
I would like to attend to Jeremiah's question about seasoned therapists as opposed to newer therapists in terms of technology. I think that's really an important piece to talk about because, so for example, I think for me, who did not grow up with a computer and maybe 20 years ago got involved with computers, there's been lots of work in terms of learning and adapting. I mean, I can do it and I'm doing it, but it's like twice as much work
Yeah.
to do so. And I think maybe the difference is too that I'm teaching and doing teletherapy, and the teaching piece has been more of a challenge given that it's totally online and I have 3 classes. But I think that I'm adapting. I feel bad for the therapists who basically just, maybe older therapists who just used maybe email or went on Facebook. And now all of a sudden they have to Zoom and get more involved with technology.
Yeah.
I think there's all levels of experience in terms of the use of technology. But I think it's a great question. I don't know.
We have to end, but I'd like to sort of hear from Frank or Beverly about being a new therapist in pandemic land and what that's
My
like.
goodness. I think it's been very challenging in many ways because I'm thinking about what's been brought up several times during this meeting in terms of having that community of the treatment team as an early career coming into at least my role as an early career psychologist, being able to run into my supervisor's office and say like, hey, I have a quick consult, about a case before I run in, and not having that has been very challenging. I think it's very isolative, and I'm finding myself having to engage in my own, processing outside of supervision, like more than I ever would, because I don't have the camaraderie of the treatment team. I can't see my peer in the hallway and say, hey, I just saw this client. Have you talked to their family? Well, I have to now set up a Zoom meeting, block out a piece of time in my day. And it's now become just double the work, triple the work to engage in. So I think it has been challenging.
I second that. I think that that there was something valuable about having peers going through the same experience, and something that now we don't have as much. I did want to speak to something that I've been helping like newer clinicians, and it's like developing rituals to stay like present in session, even in virtual times, because as we sort of to train and do the in-person stuff, you develop these like little like calming things in session so that you can be present for your clients, and for new clinicians that are not having that first experience through in person, I think it looks different, and that's been sort of a conversation, like how do I stay present even though this all is going on through this sort of virtual medium. So that has been part of the conversation. What do we do in between also to stay present with families?
A great question, Frank.
That's a great point, Frank. I have been thinking a lot about just how we slow down over telehealth versus, how it might have come more naturally in person to just be together with a client. Does it feel more intolerable to sit silently now, over Zoom and just to be with your client? Does that feel more intolerable than before in your office? We could have sat for 45, 50 minutes quietly and just been together.
Yeah.
I think that there's the thought that you can add clients back to back and not have an effect on you just because you're at home and you're able to, like, I don't know. But I've been used to already using that time in between to sort of slow myself down and sort of ground myself before I go into the next session. And I think that that practice, maybe it's not something that is talked about enough, especially for new clinicians, just to be present in the session and what's in between.